Hello guys, today I will be discussing our third module, which is the basic life support. After the things that we have discussed with the different situations in first aid, let's now tackle basic life support. So what is basic life support? So basic life support is an emergency procedure that consists of recognizing respiratory arrest, cardiac arrest, and the proper application of artificial respiration, CPR, or the cardiopulmonary resuscitation, or both, to maintain life until a victim recovers or medical help is available. So, it is necessary that in doing CPR or in doing artificial respiration to the victim, you need not to stop until until such time that the victim recovers or a medical help is available. So napaka-importante na dapat alam mo sa sarili mo na kaya mong gawin yung bagay na iyon. Okay? Because it is very useless if you will just stop at the middle. Because ang main na ginagawa natin dito is hahabulin natin yung buhay ng victim natin. Okay? So, napaka-importante yun. Let's take for example yung isang tubig or isang bottle ng tubig na half lang yung laman. 'Di ba? Ipinupush natin yon para makarating siya doon sa dulo. But if you will to stop, nakakarating ka na sa dulo na yon. Okay? Makakarating ka na doon sa point na babalik na yung pagpitik ng puso or babalik na yung paghinga ng pasyente natin. Tapos nag-stop ka because you are already you think na pagod ka na. Okay? So, napaka-useless ng ginawa natin. So, it should be continuous until na nakaka-recover yung pasyente or until such time that a medical help is available. May dumating ng medical team or ambulansya. Okay? Background and general principles. Okay? First is right side of the heart pumps blood to the lungs. So, our heart. Okay, guys? This is the heart. Okay? The heart is composed or is divided into two sides. The right and the right side and the left side of the heart. Sabi niya dito, right side of the heart pumps blood to the lungs. Okay? Andito tayo ngayon. Okay? The blood coming from the upper part of the body will enter into the superior vena cava. Ito yung vein wherein pumapasok yung mga dugo galing sa upper part of the body. And yung mga dugo naman coming from the lower part of the body, which includes our extremities and the lower trunk, ay pumapasok dito sa inferior vena cava. Okay? Those blood coming from the superior and inferior vena cava will go to the right side of the heart. Okay? Particularly at the right atrium. Okay? The right atrium is here. Then here is the left ventricle. The right ventricle, then the left atrium, then the left ventricle. Okay? So, yung blood na pumunta dito sa superior vena cava and inferior vena cava going to the right side of the heart ay mga dugo na unoxygenated. Meaning, ito yung mga dugo sa katawan natin na kumuha ng mga byproducts ng byproducts of metabolism. Okay? Ito yung mga nitrogen, mga toxic sa katawan natin, mga carbon dioxide sa katawan natin. Okay? Sumasama siya ngayon doon sa dugo na pupunta doon sa right ventricle. Okay? So what will happen now? So, yung mga dugo na galing sa right atrium will now go to the right ventricle. Then, after doon sa right ventricle, it will now go into the lungs by the use of the pulmonary artery. The pulmonary artery is the only artery in the body that carries an unoxygenated blood. Meaning, walang oxygen na dumadaloy doon sa pulmonary artery. Because artery, we know even before that artery carries oxygenated blood. But there is only one artery in the body that carries unoxygenated blood. That is the pulmonary artery. Then, after which, na dumadaloy na po siya doon sa pulmonary artery, it will now go into the lungs. Okay? Anong nangyayari doon sa dugo na galing sa superior and inferior vena cava going to the lungs? Now, lahat ng toxic or carbon dioxide, like for example, yung carbon dioxide na galing sa katawan natin, okay? Nilalabas or nilalagay niya doon sa lungs. Okay? Then, binibreathe out natin. We breathe out or we expire or nilalabas natin through our hininga or breathing yung mga carbon dioxide. Then, if we breathe in, okay, or inspiration ang tawag doon, kumukuha tayo ng panibagong oxygen. Okay? Then, yun, pag iniwan na ni dugo yung carbon dioxide doon sa lungs, then that's the time also nakukuha siya ng oxygen. Then, after siya makakuha ng oxygen, it will now go into the left atrium via the pulmonary vein. It is the only vein that carries oxygenated blood because that blood is oxygenated blood na. Okay? Meaning, meron na siyang oxygen. Okay? Then, after niya makarating sa left atrium, it will go now to the left ventricle. Then, the left ventricle will be the one to pump out the blood. Okay? The left ventricle will be the one to pump out the blood going to the aorta, distributing to the different part of the body. Okay? So, yun. That is the cycle or the circulatory system of the heart. Okay? That's the mechanism of the heart. So, once that the heart stops to beat, there will already be or there is already a stop in the distribution of blood going to the different part of the body. Therefore, nawawalan na rin tayo ng oxygen because the one that carries oxygen is the blood. And oxygen is necessary for us to survive. Okay? So, left side of the heart receive oxygenated blood from the lungs. So, I have already discussed this. Blood releases oxygen to the tissue and take up carbon dioxide. Okay? So, when breathing and circulation stops, so when the breathing stops, the circulation also stops. Because if the breathing is stopped, there is no already oxygen in the body. There is no already oxygen going to the heart. So, if there is no oxygen into the heart, then there is a tendency that we might die. Okay? Mamamatay na yung organ, mamamatay na yung puso, mamamatay na rin tayo. Okay? Or, there is already cardiac arrest. Okay? A condition when breathing stops but circulation may continue for quite some time is called respiratory arrest. Hindi na humihinga, but then still there is a palpitation or there is still a beating of the heart. That is what we call respiratory arrest. So both circulation and respiration are needed to maintain life. The brain require more oxygen than the other part of the body. That is the reason why sometimes, di ba, pag busog na busog ka, okay? Pag busog na busog ka, what will happen? Di ba, inaantok tayo, okay? So pag inaantok tayo, the reason why inaantok tayo is yung oxygen na nandito sa utak natin, pupunta yan dito sa tiyan because of digestion. Kasi masyado kang maraming kinain, so kailangan ng stomach na i-digest yung mga pagkain na kinain mo. So, more of the action of the body will go into the stomach. So, most of the oxygen will go to your stomach. That's the reason why hikab ka ng hikab, okay? Kasi nga, walang oxygen sa utak. Okay? So, let's differentiate between clinical death and biological death. So, clinical death, 0 to 4 minutes, brain damage is not likely to occur. For example, 0 to 4 minutes na wala ng buhay yung pasyente. Or 4 minutes na wala ng, there is no pulse, there is no breathing, there is no brain damage yet. Not likely. There is no likely brain damage occur. Then 4 to 6 minutes, brain damage is probable. So, 4 to 6 minutes na nawalan na ng oxygen itong utak natin, there is a tendency that some of the brain cells might die. Okay? Causing now paralysis of the different part of the body or a dysfunction. Okay? Then, 6 to 10 minutes, brain damage is certain. Okay? Brain damage is certain for 6 to 10 minutes that we sinasabi natin na biological death. Okay? 10 minutes and above, brain damage is reversible. Which is reversible, meaning it cannot be restored anymore, or the function will never hindi na siya pwedeng ibalik pa yung function ng brain, part of the brain that is being affected. Okay, so let's discuss respiratory arrest. So breathing stops, pulse and circulation may continue for some time. So na-discuss ko na yan kanina. What are the causes of respiratory arrest? Electrocution, makuryente. Okay, pag nakukuryente tayo, pwede tayong magka-respiratory arrest because of the high voltage. Okay, because of the high voltage that is that will enter into our body. Sino bang mas dangerous? Ang high voltage or yung low voltage? Okay? I think mas delikado ang high voltage for the reason that the voltage is really high. But pag high voltage naman, ang usually kasi mas prone tayo sa low voltage. Okay? Pag high voltage, ilalabas ka niya, okay? Yung impact is palabas, okay? While mga low voltage, guyudin na ka, okay? If you tried na nakuryente na, 'di ba? Pag nakuryente ka, parang hihigupin niya yung kamay mo. So, because of the current, okay? Parang hihigupin niya. Okay? Pag high voltage, iwarna ka, okay? Because of the yung impact, umadayo ka dagos, okay? Pero pag, di ba, usually may mga namamatay dahil sa bahay kasi nga yung mga saksakan or yung mga waya, mga open wire, di ba, usually maraming dun namamatay for that reason, okay? So, I believe mas delikado ang mga low voltage, okay? Okay? Next is suffocation. For example, doon pag naglilinis kayo ng mga water tank or closed door, yung sasakyan. Okay, pag close yung sasakyan, there is a carbon monoxide poisoning. Yon, that is suffocation. External strangulation, meaning mabikkel or nagpakamatay, nagbigti. Okay, there is a respiratory arrest. Droning, malmes. Okay, like what happened in Paway. Okay, then circulation collapse. For example, is hypovolemia, shock. There is possibility. Obstruction, nakatilmon ka ti piso or na-choke yung bata. There is a possibility that it might cause respiratory arrest. So, what will we do? Artificial respiration is a procedure of causing air to flow in and out of the lungs when the natural breathing of a person is inadequate to support life or ceases. So, objective of artificial respiration, you need to open the air well. So, I have already discussed to you or demonstrated to you how to open the airway. So, maximum head tilt, chin lift method, and modified jaw thrust maneuver. Head tilt, chin lift. Okay? Chin lift, ganon. Then, modified jaw thrust maneuver. Nakaganon. Okay? To ventilate and again to ventilate the lungs. So, I've already discussed to you how to open the airway, but in my demonstration, I will still be showing to you the proper way. So, what are the important aspect of AR? Get started immediately, okay? Agad-agad. Because ilang minutes before pwedeng magkaroon ng brain damage? 4 minutes, okay? 0 to 4, wala pa. Pero, dapat, after that, wag mo nang antayin pa na mag 4 minutes. Okay? Dapat within that 4 minutes na ibalik mo na yung buhay ng pasyente or yung victim natin. Because if na-prolong pa yan, the patient might die. Okay? Or the victim might die. Apply the appropriate cycles of AR later on in my demonstration. Maintain normal body temperature as supplementary help. Continue giving AR even during transportation and stabilize the patient for quite some time. External chest or cardiac compression. Application of rhythmic pressure over the sternum where the heart lies beneath. Okay? So, you need to position yourself at the left side. Pag gumagawa tayo ng ECC or the external chest cardiac or external chest compression or external cardiac compression. So, cardiopulmonary resuscitation, combination of procedure of AR or the artificial respiration and ECC or the external chest or cardiac compression to revive the function of the heart, the lungs, and the brain. Why? Again, because the lungs will give oxygen to the heart will be the one to distribute blood and oxygen to the different part of the body, and the brain is the one who controls the heart and the lungs. Okay, so napaka-importante ng tatlong parte ng katawan natin na ito. Don't in compression. So, first is don't in compression. So, the rocker, di pwede yung mga rocker, jerker, the one who, agidurduro niya permi, massager, hindi pwede, bender, double crosser, and bouncer. Bakit hindi pwede? Kasi nga, masyadong mabigat yung mga kamay ng mga ito. That may cause injury, further injury into the chest area. Baka matukol or ma-fracture yung rib cage natin, causing now na pwedeng ma-puncture yung puso. Okay? Hindi yan pwede. Kaya nga usually, di ba, yung mga naa-aksidente na yung bumabangga yung manibela dito, namamatay for that reason. Okay? Kasi nga, napakadelikado din. Okay? Huwag mong sabihin na kahit, patay naman na siya. So, why don't you try? So, hindi, bakit, why you still do it if you know that he is already dead? So, and your goal is to revive the victim. So, bakit mo po siya nga rin i-CPR? Okay? When to stop? So, stop. So, S is spontaneous pulse and breathing are restored. So, pag bumalik na yung pulse and breathing ng pasyente natin, so you need to stop. Okay? Baka mamaya, umihinga na, patuloy ka pa rin na nagsi-CPR. So, you need to stop already. Okay? Turn it over to a trained personnel or medical service. So, once na dumating na yung mga trained personnel, yung mga nurse or yung mga medical team, then you need to stop. Okay? Operator or rescuer is exhausted to continue. So, if the operator or the rescuer is exhausted, then you need to stop. But there should be somebody who will help again. Okay? Okay. So, later, sa demonstration ko, I'll show it to you how to position your hands pag there's somebody who will help. Okay? P is physicians assumes the responsibility. So when the physician assumes the responsibility, then you need to stop. Okay? And last is scene become unsafe. So when the scene become unsafe, who is the most important person during emergency cases or during disaster? It is you as the first aider. So you need to stop. Okay? So, emergency action principle, nandito na tayo. We need to know this because you will become a first aider. So, kailangan alam nyo to. So, one is survey the scene. You need to survey the scene. Okay? Is the scene is safe? Safe ba na tumulong ka? What happened? Ano bang nangyari? So, dapat alamin mo. Baka mamaya may mga bomba pa doon nandun ka pa lang. Or may mga nagpuputukan pa ng baril, pumunta ka. So, instead of helping them, probably you might be one of the casualty as well. How many people are injured? Ilan ba? Baka naman 100, 200. Okay? So, para at least makatawag ka ng tulong. Okay? Or makatawag ka ng iba pang maraming rescue. Are there bystander? Okay? May mga bystander ba? May mga pwede bang tumulong? Then, if you answer that, then assess yourself. Do I really need or do I need to do it or am I ready to do it? Okay? So if you think that you can do it, then go to number 2. Do a primary survey of the victim. So obtain the baseline information to be noted from the victim injuries which are life-threatening. So airway, breathing, and circulation. That's the ABC of first AD. Okay? Airway, breathing, circulation. So I've already discussed to you how to open the airway. Okay, look for any obstruction. Breathing, how to check the breathing. What's the normal breathing? Okay, how to assess the breathing. Look, listen, and feel. And circulation. How to check for the circulation? Check for the body temperature. O tignan mo kung malamig. Okay, kung mainit. Okay. There is a blood that is circulating in the body of the look for the color. Okay, pag bluish or violet, nagva-violet to bluish na yung kulay ng victim natin, there is probably no blood that is circulating into the body of the victim. But if the victim looks red or flashing, then there is still blood that is circulating into the body of the victim. So what are the 9 steps technique in checking ABC? So napaka-importante to. Check for unresponsiveness. How to check for unresponsiveness? By saying, hey sir, are you okay? And tapping the shoulder of the victim. You need to tap the shoulder of the victim and say, hey sir, are you okay? Hey sir, hey ma'am, are you okay? Or pag baby. So 4 na beses yun. Okay? So, if unresponsive, shout for help. Okay? Pag nakita mo, hey sir, are you okay? Then, unresponsive. Then, shout for help. Huwag namang help. Okay? So, be specific. Okay? So, help. Gaganon ka lang. Sino tutulong sa'yo? Baka mamaya, 20 yung bystander doon. Sabi na, sino ba? Sino sa atin? So, para at least, be specific or identify the person who will help you. Okay? So, paano pag anong sasabihin? Hey, man in blue, with a cup of white, or man with a cup of black. Okay? Call 911 and report it back to me. Sabihin mo that he need to report it back to you. Baka naman mamaya na pa nagluton. Akala mo natakot. Umuwi na pala sa bahay. Hindi na bumalik sa'yo. So, you don't know what happened. Okay? Nagsi-CPR ka, ang tagal-tagal na, wala naman palang dumating. Akala mo, tumawag na ng ambulansya, wala pala, umuwi. Nagluto na lang sa bahay, natakot. Okay? Na baka masali siya sa kaguluhan. Okay? So, you need to say, hey sir, are you okay? By tapping the shoulder, then shout for help. If it is unresponsive, shout for help. Hey, man with a black shirt, call 911 and report it back to me. Okay? Then position the victim if necessary. You need to position the victim if necessary. Then open the airway, check the airway. Head tilt, chin lift, look for any obstruction. If there is obstruction that you have seen, then tanggalin mo. Pag sa bata, use your the little finger or the... Then check for breathing. By look, listen, and feel, 3 to 5 seconds only. Huwag mong 1 full minute, okay? Because ilang minutes lang yung aantayin natin? 4 minutes, okay? 4 minutes lang. Pwede nang magka-brain damage yung pasyente. And 10 minutes na walang tayong ginawa na hindi natin na-survive revive yung victim, the victim might be dying. Okay? So, very useless yung ginawa natin. So, hahabulin natin yung oras at hahabulin natin yung buhay ng victim. Okay? So, 3 to 5 seconds. If breathless, give 2 initial ventilations. Okay? Give 2 blows. Okay? So, in my demonstration, I'll be showing to you. Check for pulse. 10 seconds. Para sa mga sa adult, check into the carotid pulse. Pag sa mga bata naman, brachial pulse. Okay? 10 seconds lang. Okay? Later on, I'll be showing to you or I'll be discussing to you the proper counting. Okay? Ama. So, if you check the pulse, then it's positive pulse or there is a pulse, then arrange transport facility and report back to me. Okay? Then, do necessary first aid measure. Then, after doing your first aid, go back to step number 7, which is checking the pulse. Then, number 3, activate medical assistance. Then, number 4, do secondary survey to the victim, head-to-toe assessment. So, I have already discussed to you how to properly assess cephalocaudal, meaning from the head, okay, to the foot. Because the most important, the head, the brain is in the head. So, that's the most important part of the body that you need to check. Okay? So, are we ready now? Let's proceed to page number 5. Okay? So, adult CPR. So, paano to? Okay? So, sasabihin ko muna, then I'll be demonstrating it to you with my second video. So, the scene is safe. I have 1 victim and 1 bystander. So, wag mo sabihin, the scene is safe. I have 1 victim and 1 bystander who can help. Okay, you need to be alert. Okay? You need to be alert because it is in an emergency situation. Okay? So, the scene is safe. I have 1 victim and 1 bystander who can help. I am Elmore, a trained first aider. I can help. Hey sir, are you okay? Hey sir, are you okay? Unresponsive. Please activate medical assistance and report back to me as I do my primary survey. Nose is clear. Mouth is clear. No obstruction seen. So, how is the counting? 1, 1,002, 1,003, 1,004, 1,005, 1,006, 1,007, 1,008, 1,009, 1,010. Breathless. Because I have what I have said in the discussion late kanina is you need to check the breathing 10 seconds. Okay? So, give 2 initial blows. Sabi ko kanina, di ba? Give 2 blows. Okay? 1, 2. So, 1, 1,002, 1,003, 1,004, 1,005, 1,006, 1,007, 1,008, 1,009, 1,010. Breathless. Negative pulse. Negative breathing. Okay? Please follow up medical assistance and report back to me as I do my CPR. How is the CPR and how is the counting of the CPR? So 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20. 1, 2, 3, 4, and 1. That is, and then give 2 blows. That is 1 cycle. You need to do 5 cycles. Okay? Pag hindi pa rin, just continue lang. Okay? But, para at least makagawa tayo the pinaka minimum is doing a 5 cycles. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 2. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 3. Give 2 blows. Okay? 1, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 4. Give 2 blows. Then 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 5. Give 2 blows. Okay? So you need to, after that, you need now to check the pulse and the breathing of our victim. So 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Positive pulse, negative breathing. So meaning, there is already a pulse of our victim. So kailangan pa ba na mag-compression or ECC, external chest compression or external cardiac compression? Kasi may pulse na? No, you don't need now. Okay? So proceed now to respiration. Kasi sabi niya dito, positive pulse, negative breathing. So ang focus na natin ngayon is the breathing. Okay? Please follow up medical assistance and report back to me as I do my rescue breathing. So blow. You need to start with the blow. 1002, 1003, 1001. Blow. 1002, 1003, 1002. Blow. 1002, 1003, 1004. Blow. 1002, 1003, 1005. Blow. 1002, 1003, 1006. Blow. 1002, 1003, 1007. Blow. Until 1002, 1003, 1024. Blow. Okay? Then, you need to give 24 blows to the victim, or 25 I mean, because you have started with a blow. Okay? Then 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Positive pulse, positive breathing. Please follow up medical assistance and report back to me as I do my secondary survey. From head to toe, no blood seen. From head to toe, no decap BTLS. What is that decap BTLS? So, the victim is revived and ready to transfer. Deformity. May mga sugat ba? Okay. May mga fracture ba yung victim natin? Contusion. Tignan mo may mga pasa, may mga bukol, or may mga bugbog. Okay, tignan mo. Abrasion, may mga gasgas. Puncture, adaba na itudok. Kanya na. Burn, ada na uram, mga part ng katawan natin. So, and tenderness, o adaba na lulung, parte ng katawan ng victim. Laceration, adaba na cut or nasugat. Kanya na nga parte na iwa. Okay, swelling, adalimteg, nga part di vagina. So, that is the CAP BTLS. Okay? That is for adult. Let's go to infant CPR. Then, infant CPR. The scene is safe. I have one victim and one bystander who can help. I am Elmore, a trained first aider. I can help. Baby, tickle. So, how is the tickle? So, alam niyo paanong bata igaganon natin. Okay? Yung paa niya. That is tickle. Baby. Okay. In my next demonstration, in my next video, I'll be demonstrating it to you how is the proper way on how to do CPR sa mga baby. Okay? Unresponsive. Please activate medical assistance and report back to me as I do my primary survey. Nose is clear. Mouth is clear. No obstruction seen. 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Breathless. Blow. Air bounces back. Blow. Air still bounces. Bakit sasabihin natin ng ganon? Kasi usually, ang CPR natin mga bata, di ba, mostly na choke. Okay? Na bilaukan. Okay? So, blow, air bounces back. Blow, air still bounces. Meaning, bumabalik yung hangin. Okay? If you try to introduce air into the mouth and nose of the victim, of the baby, bumabalik, okay, yung air na ni-introduce natin. Meaning, nakabarado dito sa may throat ng victim or ng baby. So, give 5 back slaps, okay? 5 back slaps. So, by the use of this part of our hands, okay? The palmar area dito. Okay? So, 5 backs. 5 back slaps, okay? And 5 chest thrust dito naman sa may parteng ito. Okay? Ito naman ang gagamitin natin. Okay? 5 chest thrust. 1, 2, 3, 4, 5. I'll be demonstrating it to you. Okay? Then, obstruction scene. obstruction, remove. Okay? Blow, air goes in. Blow, air goes in. Okay? Meaning, nung nag-introduce ka na naman ng air, pumasok na or nag-enter na siya sa lungs ng victim. So, let's continue. So, need to check the breathing and pulse, the respiration and the circulation of the victim. So, 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Negative pulse, negative breathing. So, please follow up medical assistance and report back to me as I do my CPR. So, how is the counting? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 1, 2 blows. Okay? So, pareho lang ng counting ng bata at saka baby. Okay? Then, after that, after 5 cycle, 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Then, positive pulse, negative breathing. LLF position meaning lock, listen, and feel position. Please follow up medical assistance and report back to me as I do my rescue breathing. Kasi nga may pulso na. So blow. Okay, ito yung pagkakaiba ng adult at saka sa baby. So blow 1, 1001. Blow 1, 1001. 1, 1001, blow. 1, 1002, blow. 1, 1003, blow. 1, 1004, blow. 1, 1005, blow. 1, 1006, blow. 1, 1007, blow. 1, 1008, blow. 1, 1009, blow. 1, 1010, blow. Until 1, 1040, blow. Okay. So, then after that, after the 40 cycle of rescue breathing, then you need now to check the breathing and circulation. 1, 1002, 1003, 1004, 1005, 1006, 1008, 1009, 1010. Positive pulse, positive breathing. Please follow up medical assistance and report back to me as I do my secondary survey. From head to toe, no blood seen. From head to toe, no decap BTLS. The victim is revived and ready to transfer. As what I've said, what is decap BTLS? D for deformity, C for contusion, A for abrasion, P for puncture, L for laceration, T for tenderness, and S for swelling. Okay? Okay? Other points to remember in giving CPR or the cardiopulmonary resuscitation is the chest compression. For adult, you need to use both your two hands. Okay? So, I will not tell if it is on the right or the left because some of us, ang dominant hand natin is the left. Most of us, ang dominant natin is right. Like for example, me, my dominant hand is my right hand. So, my right hand should be at the top. Okay? Should always be at the top. Okay? Kasi siya ang co-control. Okay? Okay. So, pag sa child, should be the only one hand. Okay? Pag infant, 2 finger. Okay? 2 finger. Okay? Pag adult, saan tayo magko-compress? Okay? Dito sa may sternum part. Okay? You need to position yourself at the left side dito sa may sternum part. Then sa child, dito sa may sternum pero iisang kamay. Pag infant, some below the nipple. Okay? Below the nipple. Okay? Press down. How many? For children, you need to press down 2 inches. Pag adult, 2 inches. Then even sa child, 2 inches. Pag sa mga infant, it should be 1.5 inches. Okay? Perform 30 chest compression at a rate of 100 per minute. Okay? So, I think that's the end of our discussion. Your activity to me will be discussed after the demonstration. Okay? Thank you and God bless.